DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, Dr. Dan from DocTalk. Thanks for joining me today on the show. We're going to talk about a very important topic, using steroid implants in suckling calves. My guest today is Dr. Chris Reinhardt, who is our state feedlot extension specialist and is an international expert on steroid implants in beef cattle. Thanks for joining me, and stay tuned after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. Dr. Reinhardt, thanks for coming.
Howdy.
Folks, Dr. Chris Reinhardt, he is a PhD ruminant nutritionist, and he is the state feedlot extension specialist for beef cattle here in the state of Kansas. He's over in the animal science department, does a lot of work with me. I'm over here in the College of Vet Med, and you know, it's one of those things whenever we get to talking about steroid implants, we have a pretty good understanding of the feedlot, once they get there, but I still get a lot of questions about what are we going to do for suckling calves, and specifically, we have different groups of cattle. We have the ones that we're going to retain ownership, the ones we're not going to retain ownership. Some of them are going into the breeding herd, males and females and steers and bulls, and many different outcomes. So what are some of your general philosophies on this? Let's start out with like potency of implants.
You're right, Doc. The suckling calf offers us a few wrinkles that stocker cattle and feedlot cattle really don't provide us. But strictly in terms of some generalities, dosage of implant, I always say let's match the dose of the implant to the size of the animal and the amount of available nutrients for that calf.
Right. So when we have a calf that's out there that's nursing and starting to nibble on grass, probably a lower potency implant?
Exactly. We are really blessed in this country to have products available specifically for that animal at that stage of life and at that stage of nutrition.
So give me some examples of the ones that we're talking about.
Real commonly, we've got the Synovex C implants and similar doses to that. That's a low dose of estrogen and a low dose of progesterone in addition to that. Ralgro has been around forever and is a completely different molecule, and yet it acts virtually the same, in the same manner, providing about the same amount of growth promotion as the Synovex C type product.
They still haven't made an implant gun as good as the old Ralgro metal, shorter needle, easy to handle, don't get your knuckles busted, in close.
Fewer moving parts is almost always a good thing.
Yeah, not plastic. But so we're going to go with the lower potency. And is there a time frame on when we would be thinking about using that implant as far as age of the calf?
Definitely. We want to shoot for that at bare minimum 1 to 3 month age time frame. I've been digging through some of the old literature, and to go under a month, we can actually have some negative side effects.
So we're going to wait at least a month, and then when we hit that month, so anytime like branding, at that 3 months, when we vaccinate calves before turnout, that could be a good time to catch that calf and implant them.
That's the time to do it, Doc.
So, and that was the other thing is somebody'd say, well, when am I going to worm them, or when am I going to implant them? It's going to be when I have them caught.
Exactly.
So a lot of times we don't have much say in it. Well, let's take a break. When we come back, let's start getting into some of those differences as far as bulls, steers, heifers, replacement heifers, things to that, some of those more controversial topics. Thanks for watching Doc Talk. We have a good one with us today, Dr. Chris Reinhardt from the Department of Animal Science and Industries here at Kansas State University.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Benjamin Potvin is a third-year veterinary medicine student at the University of Guelph. He grew up on a small cow-calf farm in Nova Scotia, where his passion for working with cattle in the agriculture industry was established. Upon graduation, Benjamin hopes to find work in a high-volume, dairy-focused practice with strong mentorship within the United States.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Chris Reinhardt. He's from the Department of Animal Sciences and Industry here at Kansas State University. I teach over here at the College of Vet Med where we're shooting this today. And we do a lot of work around the state, around the country with beef cattle, and nobody is better at ruminant nutrition and steroid implant knowledge than this guy sitting next to me. So we're really happy to snag some of your time. And let's talk a little bit about what kind of performance or efficiencies are we talking about when we use steroid implants?
Two things I always want producers to remember is anytime a calf is gaining weight and has enough nutrients available to gain weight both from milk and from grass, an implant is going to pay for itself. The second thing I always stress to producers is the only implant that doesn't work is the one you left on the table.
Right. So the ones that you don't use, or the one you put in inappropriately that falls out.
Exactly. A real round figure to use is about 5 to 10%.
Well, that's a significant increase when you're talking about average daily gain, or if you're talking about pounds sold. I mean that would be at our weaning weight or our calf weights. You know, 5 to 10%. That's some serious money laying on the table
for something that cost you roughly $1 to $2 an animal.
Yeah, that when you're looking at a return on investment of $40-50 per steroid implant, and that, folks, is real money and something you need to pay attention to. Now, the one time we don't use those is if you're going to feed into one of these natural programs, and so it does maybe have some limit to your marketing. But I think you need to figure in how much more do I need to market that calf for to make up for the lost performance that we're going to see, or lost efficiency.
That's exactly right, and those programs definitely have a place and can provide value. We just have to run a sharp pencil and make sure we're making more than just a break even.
Right. So then let's just kind of stay on the topic of steers. One of the questions I get is, will that impact quality grade? Implanting the calf, on the cow, how does that have an impact if I'm going to retain ownership on quality grade of those cattle when they go to slaughter?
Back to what we had mentioned before, if we match the dosage to the size and age of the animal and to the available nutrition for that calf, we should really expect minimal, if any, detrimental impact on future quality grade.
Okay, so quality grade's okay. We're going to get a 5 to 10% increase in performance. Any negative impact on using a steroid implant in these steers? And again, we're going to talk more about replacement heifers or bull calves, but is there anything that you can think of that's negative?
The question that commonly comes up is, what about the future owner of that calf, the stocker operator, the feedlot owner?
Sure.
Does he get less value from the implants he uses at the next stage? And the data I've scoured over the past few months says no. If we're using the right dose for the right animal, the next producer to own that animal is going to get full value from their program as well.
And these are a lot of, short day implants anyway.
Exactly. The dosage is relatively low. The calf is gaining. Should be a win-win.
Great. Folks, when we come back, we'll talk more with Dr. Chris Reinhardt. You're watching DocTalk.
The BQA Tip of the Day, sponsored by Behringer Engelheim Vetmedica, Inc.
This is Shane Terrell with Production Animal Consultation, here with today's BQA Tip of the Day. Today we're going to talk about proper organization or good organization of the work area, primarily for employee safety or the safety of those people working in this area, and for efficiency of processing. The first example is, and as you can see, this yard is using multiple clips, magnetic clips and hooks, so we can organize products in a manner in which they can be used systematically, so they're administered to the proper area, and we're applying those products with proper spacing. Other examples would be hanging cords or dropped cords that allows for less opportunities for processors to trip. Other examples would be having tags laid out in an orderly manner to speed up the efficiency of processing. Any record keeping that needs to be done, having a space available so that can be done in an efficient manner.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease. With the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Chris Reinhardt. We work at Kansas State University. We play a little bit too. But Dr. Reinhardt is the State Feedlot Extension Specialist for the state of Kansas, and he spends a lot of time in other states and other countries as well, and a true expert in steroid implants and ruminant nutrition. And Dr. Reinhardt, when we think about implants on suckling calves, we talked about steers, increase and improvement, 5 to 10% weight gain and efficiency, but now let's start talking about some of the groups that we might want to think about not doing it. And let's start out with breeding bulls.
Yeah, again, something we're trying to measure in those bulls is their genetics for performance. The implant may help that. We don't have a lot of data on those young bulls using implants, but the key is to remember that their purpose is for fertility, for intact sperm, libido, etc., and we don't want to do anything to upset that apple cart with the current value of breeding bulls. And so we don't really have good data to say that those products are completely innocuous on their future fertility. Let's not mess with Mother Nature.
Yeah, when you start to think about when we're using estrogenic compounds and the impact it could have negatively on testicular development, we definitely don't want to be using those types of products in animals that you're going to keep back as breeding stock. And then the other one that I get a lot of is, well, I'm not going to castrate my bulls because I'm just going to use the steroid that the good Lord intended that calf to have, and then I'll castrate them at weaning. Well, two things. One, they have to go through puberty before they get testosterone produced from the testicles, and puberty is generally after weaning time, and so we really don't have any advantage of leaving those bulls intact for growth performance. You'd actually be better off to castrate those calves at branding and use a steroid implant to get that 5 to 10% bonus and bigger weights than leaving those bulls intact.
And then, as you well know, Dr. Dan has done tremendous amount of research on the stress that late castration has on these now nearly mature animals, where you've taken away a very painful procedure.
Yeah, I always tell people castrate calves when they're young, because the longer the testicles are attached to the calf, the more attached the calf is to the testicles.
Ouch.
So we want to make sure that we do it when the calf's young, use a steroid implant, get along great. And, I think that the end of the day, don't use steroid implants on breeding bulls.
100%.
All right. Well, we're going to tackle heifers next, but I think we'll save that for the next segment. Anything on these breeding bulls or anything on steers?
The genetics we've got available today are tremendous compared to even when you and I were kids. The genetics for growth in these bulls is fantastic. We don't need to supplement what they've got going for them already.
Yep. And even as good as the genetics are, don't leave that money sitting on the table. Make sure you use a steroid implant. We're going to take a break. When we come back with Doc Talk, more with Dr. Chris Reinhardt on implanting suckling calves.
This week's That's My Breed, brought to you by GENETRUST. Visit us at GeneTrustBrangus.com.
The adaptability of Brangus cattle are bar none as good as I've seen anywhere. You put them in an environment It can be a low input environment, a high input environment. These cattle will excel. But the Brangus breed has a strength, in my opinion, in the commercial industry. We have marketing ability from Angus heritage that allows us to get that average choice and higher. And the number of commercial cattlemen that are sitting there buying these Brangus bulls and knowing that they're going home and producing commercial influence Brangus heifers that I know are going to excel in udder quality and fertility, longevity, and can produce a heavy weaning weight calf. It's just incredible to see commercial cattlemen utilize our cattle. Now's a good time to be invested in the cattle industry. And if you're going to do that, why don't you invest in the right genetics? Brangus genetics that you know will do it economically, they'll do it with limited inputs, and give you maximum outputs. That's where the profitability is.
Nestled in the heart of the Flint Hills lies one of the most proven and productive seed stock herds in the country. Based on fertility, longevity, and soundness, these cattle combine impeccable maternal strength with a performance and carcass foundation built to meet the highest standards. Vernon and Vicki Suhn and the GENETRUST partners invite you to join them on March 22nd at Suhn Cattle Company for their 23rd annual event, offering up 170 Brangus and Ultra Black bulls backed by complete performance information and genomically enhanced EPDs. For more information, visit GeneTrustBrangus.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Working your cattle just got easier. Introducing the new Vet Gun delivery system, a new way to apply topical insecticides to your cattle. The Vet Gun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML Vet Cap is used with the Vet Gun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. Vet Gun. Check with your animal health supplier for availability.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chris Reinhardt talking about implants on suckling calves, and let's get to the heifers because that's we made you hang on to the end. That's just like all the other shows, right, for the grand finale, because everybody always wants to know about implanting heifers.
Here it is.
All right, right now. So talk to me about heifers, repro, heifers, performance, things of that nature.
Yeah, broadly, Dr. Dan, if you know which heifers you're going to retain, don't use an implant in them, because there is a risk, a potential downside risk, which is either very small or very large, depending on how you manage that implant program.
And there is no downside to not implanting the heifers reproductively. So the only thing is, above all, do no harm. If you know you're going to retain those heifers for breeding purposes, then make sure you don't implant, just like the bulls. But what about the ones I don't know? You know, what are some of the things I can expect if I do, say I implant them at branding, and then I make the decision to keep them later?
Okay.
What should I expect?
Again, if we're using the appropriate dose for the appropriate animal, these low-dose implants are very mild. If that animal has sufficient nutrients available, we wait until roughly that 1 to 3 month age window. We should expect virtually no change in future fertility. If we give that implant too early or double up on the implant or any number of other ways to, I'll call it mismanage the program, you could hurt fertility. But if we've given the appropriate dose at the right time, we shouldn't expect any downside.
So giving a heifer calf a low potency implant at branding is going to have, and no other steroid implants, is going to have zero to minimal effects on fertility.
That's exactly right. And we get the extra growth if we sell her as a feeder animal.
Great. Well, it's been a great show. I appreciate you being on here today. Any parting comments or words of wisdom on suckling calves and implants?
Well, once again, as you mention all the time, Doc, we are really blessed in this country to have technologies available to us to help maximize performance from our inputs.
Yep. Well, folks, Dr. Chris Reinhardt, Kansas State University, Department of Animal Sciences and Industry. Thanks for joining me today on DocTalk. Remember, always work with your local veterinarian. If you want to know more about us on DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thompson. Thanks for watching our show today. I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.